found out that one of my best friends tested positive for HIV. And it was a pretty scary time for both of us. So I accompanied him in all of his preliminary medical visits, sort of held his hand. And it was really cool watching him go from finding out his new diagnosis to then becoming stable on medication, reaching an undetectable status. And finding someone that could have that much impact on someone's life was what got me interested in HIV in the first place. So what happened was I ended up changing my major that next summer and then went pre-med after that.
So for me, going into HIV primary care, it was a personal passion of mine. Prior to going into medicine, I worked in HIV prevention and harm reduction work in New York City and saw how sexual health issues and gender identity issues were impacting myself and my friends and family. That's sort of what led me into HIV primary care, is the reason I went to medical school in the first place.
There is so much opportunity in this fellowship to make connections and bonds with other specialties and other specialists and learn more about medical management, medical legal issues, politics involved with medicine as well. That is also incorporated in your day-to-day clinical activities.
After finishing the fellowship, my career has led me to a public health position at the Los Angeles County Department of Public Health Division of HIV and STD programs. But because of my training, I definitely was a good fit for being, sort of the lead on the HIV treatment aspect.
So after completing my fellowship, I moved down back home for me to New Orleans and have a job at LSU, which is our state university here. And I'm getting to work at both New Orleans' oldest HIV clinic, which is called the HOP Clinic, the HIV outpatient program. The training that I got in the fellowship program really helped me feel comfortable both in my clinical knowledge, especially in terms of HIV. I really feel like I can keep up with the infectious disease doctors I work with. And I also felt like all this time and experience I had working with students and residents in the fellowship really gave me a good foundation to continue to work with learners now that I'm out and practicing.
There's just so much diversity involved in just one fellowship that I'm not sure other programs would have provided for me.
The fellowship prepared me to be a medical director. During the course of my fellowship training, we rotated at different sites all around DHS. So going through the classes at UCLA also helped me provide the skills to become a good medical director. It really set a good framework from which I was able to approach a healthcare organization and be able to identify areas for growth and opportunity in the system, be able to identify the key stakeholders within the organization that needed to be able to work alongside with me to affect change, and also be able to build a coalition to enact those changes that needed to be implemented into the program. And I don't know any other way I could have had that experience had I not gone through the fellowship.
Which is really quite radical and very, very unique. And so I think the fellowship prepared me as a clinician now, because I have a pretty in-depth idea of what it means to work at every point along the HIV care continuum.
And it solidified the confidence that I had in the clinical training that I received. Just to see them in that role, being able to be attendings, professors, and really teaching med students, residents, and now fellows, truly gave me the confidence in the clinical training that we receive here in the HIV Clinical Fellowship.
Also, I got to sort of model myself after a bunch of brilliant individuals that were super passionate about patient care. And I think that makes the difference in the training program.